Non-invasive prenatal testing, or cell-free DNA screening for chromosomal abnormalities, has been now available for over 10 years. It's a major advance in screening the unborn baby. What we can do is essentially take a blood test from the mother early in pregnancy to look at the baby's DNA inside your blood. It's a huge advance. Obviously, we have very high detection rates for chromosomal abnormalities and a very, very low screen positive rate, so we worry very few women. Like everything in DNA technology, things have advanced at a great pace, and nowadays we can look at more than just Downs, Edwards, Patterns. Traditionally, when the test was implemented, we were screening for these 3 chromosomal abnormalities. Millions and millions of mums have had the test, and we know it works very, very well, with very, very high detection rates, and we worry very few women. With advances in DNA technology, we can look at more and more of the baby's DNA inside your blood. So essentially, at Harley Street Centre for Women, we are committed to providing the very best care for you and your baby. And we have selected 2 different options of tests. One is the standard test, where we can screen for Downs, Edwards, Patterns, trisomy 21, 18, 13, and tell you the sex of the baby. It's a very, very good test. It works extremely well. But with advancing DNA technology, we can now offer you something called targeted genome-wide cell-free DNA screening, or NIPT. And this test will look at far more than just the traditional chromosomes 21, 18, 13. We look at other chromosomes, we look at other genetic problems, we look for things called microdeletions, where there's little bits of DNA missing or extra little bits of DNA, and we look for specific genetic disorders. The advantage of this test is that we're looking for a greater number of conditions that are clinically significant and can cause a problem for the baby. There is no good or bad test. It's all about options and choices. The standard test is an extremely good test. The advanced genome test is an extremely good test. The difference between the 2 tests is that the standard test takes about a week to get results, while the genome-wide, because it's much more comprehensive, takes about 2 weeks to get the results back. The screen positive rate for the standard test is around 0.3%, but for the genome-wide test, because we're screening for far more conditions, it's around 1.5%. So there is a difference in as much as slightly higher number of women will be given the option of invasive testing. Here at Harley Street Centre for Women, we will discuss the 2 tests with you and give you the options so that you can decide which is the best test for you and your pregnancy.